Skills critical to the success of a dental hygienist's clinical practice involve the detection and removal of hard deposits. Many hours of practice are required to develop and master these skills. The following video provides demonstrations of instrumentation techniques using the Gracey curettes. The Graceys demonstrated in this video have flexible shanks, useful for moderate to fine calculus. However, more rigid shanks are available for abundant and dense calculus.
Note the design characteristics of the Gracey 5/6 Mini and Regular. As with all Gracey curettes, the working end terminates in a rounded surface called the toe. As with all area-specific Gracey curettes, the face is offset to the terminal shank at approximately a 70-degree angle. The Mini 5/6 is designed for areas with restricted access. The regular Gracey 5/6 may be used on areas where access is not restricted. The clinician places the cutting edge of the Gracey 5/6 against the midline of the tooth surface. Note the terminal shank. It is parallel to the long axis of the tooth to be debrided. Observe the face. It tilts towards the tooth. The face is partially hidden from view. This will identify the correct working end has been selected. Note when the wrong end is selected, the face is fully visible. An 8 o'clock position is assumed for the right-handed clinician, while the left-handed clinician will sit at the 4 o'clock position to use the Gracey 5/6 on the facial of the mandibular anterior sextant surfaces towards. Note that the operator leans slightly forward from the waist and the forearms are parallel to the floor. The head is held up while the eyes are directed down into the oral cavity. View the clinician technique 4-3 to 4-1 surfaces toward. With the face closed to a less than a 70-degree angle, the instrument is inserted. The toe simply slips under the gingival margin. The correct 70-degree angulation is achieved when the functional shank is held parallel to the long axis of the surface to be instrumented. It is essential to recall the anatomy of the root surface being debrided to accurately angulate. Constant repositioning of the head is required to maintain ideal access and visibility. Note how pivoting on the fulcrum maintains constant adaptation of the toe around the line angle. The clinician sits at a 12 o'clock position for surfaces away on 4-3 to 4-1 facial. The working end has changed. Note the modified pen grasp. An exploratory stroke is used when positioning the toe under the deposit. A firm vertical working stroke is then activated coronally. Closely observe the insertion. several strokes are required to ensure thoroughness. Horizontal strokes may also be used to finish the facial areas line angle to line angle. The following demonstrates the use of the Mini Gracey 5/6 Curette on a client. Observe closely. Note, an approximate 70-degree angle is maintained, following the contour of the root surface as it is instrumented. Light exploratory strokes are used when the instrument is directed gingivally. Firm strokes are engaged when a deposit is detected. The toe is directed under the edge of the subgingival deposit, allowing the cutting edge to engage and remove it. The non-dominant hand retracts the lip. Now observe how the toe is wider than the contact area. A sickle scaler is required to finish deposit removal under the contact. Observe instrumentation of surfaces away. Pay particular attention to the fulcrum. It allows the clinician to securely adapt and angulate to each surface. Activation on a secure fulcrum ensures the clinician maintains control. Horizontal strokes are made towards the operator. This ensures thorough debridement of the facial surfaces. The regular Gracey 5/6 is demonstrated on 2/3 to 2/1 facial surfaces towards. The clinician sits at a 12 o'clock position using direct lighting and direct vision. Retraction of the upper lip is required. Observe insertion at the distal line angle and instrumentation across the facial toward the operator. Note how a complete change in direction is accomplished when the toe of the instrument reaches the mesial line angle. Pivoting on the fulcrum allows the clinician to change from the oblique stroke used on the facial aspect to a vertical stroke used into the contact area. Observe as the clinician continues to demonstrate deep subgingival instrumentation techniques. A 70 to 80 degree angulation is maintained to the surfaces being debrided. Observe as the clinician now demonstrates the Gracey 5-6 on surfaces away. Watch as the hand works as a unit to accomplish controlled working strokes. Again, it should be noted that only 1 to 3 millimeters of the cutting edge is adapted when removing deposits. Horizontal strokes are made towards the operator. This ensures thorough debridement of the facial surfaces. Watch closely the clinician technique while instrumenting all facial surfaces of the 2-1 with the regular Gracey 5-6. Note the design characteristics of the Gracey 1112. Multiple bends in the functional shank facilitates adaptation to facial, lingual, and mesial surfaces in the posterior regions. View the position of the terminal shank and the direction of the toe. The terminal shank is held parallel to the long axis of the tooth being instrumented, and the toe is always directed mesially. If the correct end is chosen, the instrument face will tilt towards the tooth surface. As you look down on the working end, the face is partially hidden. Beginning at the distal line angle, note how the toe is slipped into the sulcus for insertion with a decreased angulation, and the toe remains at the line angle where instrumentation begins. Oblique strokes are used to debride the lingual surfaces to the mesial line angle, where the clinician pivots, changing to vertical strokes while instrumenting into the mesial contact area. For horizontal strokes, the working end is repositioned at the distal line angle, with the toe directed toward the epithelial attachment. An angle of approximately 80 degrees is established. Short, well-controlled strokes are activated. It is important to ensure the terminal shank is held close to the tooth but never contacts the lingual bulge of the tooth. Pivoting at the mesial line angle, vertical strokes are now used into the mesial contact area. Horizontal strokes around the distal line angles are used to achieve thorough debridement. An 8 o'clock position is assumed for the right-handed clinician, while the left-handed clinician will sit at a 4 o'clock position to instrument the lingual and mesial surfaces of 4-7 and 4-6. Indirect vision and indirect lighting is required. Beginning at the distal line angle, the clinician will instrument the lingual surfaces. Observe how the clinician adjusts the fulcrum to be closer to the area to achieve a 70 to 80 degree angulation into the mesial contact. The shank must be held as close to the mesial line angle as possible. With the toe directed toward the epithelial attachment, horizontal strokes are activated around the distal line angles to achieve thorough debridement. It is important to ensure that the terminal shank never contacts the lingual bulge of the tooth, but is held as close to the tooth as possible. An optional approach for the mesial surfaces is to change to an 11 o'clock position while using direct vision to instrument from the mesial line angle into the mesial contact area. Watch closely the clinician's technique while instrumenting the 1-6 and the 4-6 lingual on a client. It is important for the clinician to ensure the terminal shank is close to but never rests on the lingual bulge. Note the design characteristics of the Gracey 1314. Multiple bends in the functional shank facilitates adaptation to the distal surfaces in the posterior regions. The terminal shank is positioned parallel to the long axis of the tooth, and the toe is directed distally. The lower portion of the functional shank is above and parallel to the occlusal surface. If the correct end is chosen, the instrument face will tilt towards the distal surface and the face will be partially hidden from view. An 11 o'clock position is assumed for the right-handed clinician, while the left-handed clinician will sit at the 1 o'clock position to instrument the distal facial of teeth 1-6 and 1-5. Beginning at the distal line angle, the operator will insert the instrument with the toe towards the distal contact. The toe is inserted into the sulcus at a decreased angulation. Then a 70-degree angle to the root surface is established. Observe how the clinician maintains toe adaptation. Watch closely the clinician's technique while instrumenting 1-6 facial and 2-6 lingual on a client.
Practice is essential for the development of the fine motor skills required for instrumentation techniques. Refer to this video frequently during your practice sessions to ensure you are consistent with the techniques demonstrated.